How much do you want a better quality of life?
Do you think you'll sit there the entire time?
Probably.
Yes.
Hi, I'm Kaylene and I'm from Bayswater. Things were fairly dire for a few years. I had a top denture which had needed relining and got loose. As a kid I had what they called chalky teeth, which I think is low minerals in the enamel, I'm not really sure. And I was at the dentist twice a year, most of my life. Root canals, crowns, lots and lots of money. And I looked at doing implants a few years back, and the price was huge, but you have to weigh up the benefits. I won't have to have a crown again, ever, or a root canal treatment. And those sorts of things really swayed me in the end. And then I found out I could use my super to pay, and that was the game changer. And I thought, yeah, why not? I haven't been able to eat properly for years. I had 8 teeth left across the bottom, none at the back. Steak was a no-no. Apples, lots of things, crunchy things, nuts, chocolate. So I did a bit of research and found Michael at Aria. Michael wasn't the first place I went to. I actually spoke to a couple of other people. One advised me not to have implants. He said he wasn't sure there was enough bone left. I persevered, and Michael was just so good. The staff was so friendly. It wasn't daunting at all, actually, and it had been. Big decisions. So, they were really lovely, and it happened so fast, really. Everything was done so quickly. I think Michael really cared. Not that the others didn't care, but in lots of professions, they have the knowledge and the know-how to do things, but the fact that they care about you and how your life is, that I think made me decide, definitely. It's a pretty amazing man. Going in, I think I had an appointment with Michael, and straight away I had the scans done. And it was so instant, didn't have to go anywhere else to have them. It was all done there, everything was there. And then they put together a couple of different plans for me, on payment plans and alternatives to having a full set of implants, to try and keep maybe the 8 bottom teeth. But I'm a bit of a grinder, and it wasn't worth keeping those teeth. So we went ahead, and that happened within a few weeks. Really, everyone explained everything along the way. The changes, the people in the lab, Cosimo, when they first put the implants in, I was lisping. My bite wasn't correct because of the dentures that I'd had. So over time, they changed the bite with different temporaries. So I bit my tongue a few times. But eventually, it came out perfect. I can even whistle now. I haven't been able to whistle for years properly.
Give us a whistle.
I whistle for him. Huge difference. Confidence, I think, is the main thing. And I've heard a lot of people that have had their teeth done the same. Would talk with your mouth sort of half open a lot, laughing, very conscious of not opening my mouth too far. Now it doesn't matter. Now you can just be yourself and laugh with your mouth wide open if you want to. everything, things that I couldn't eat before, for quite a long time. I've heard people talk about, biting into crisp apples, but I guess I'm not a big steak eater, but when I feel like a steak, I like a steak. And to be able to chew now all the way through and not just have tiny pieces, it's all good. Because that's what it is. It's a better quality of life. And at first I thought, I'm getting older, is this really worth it? Yes, it is, absolutely.